Drugs can act through various mechanisms to produce their effects. While some drugs work due to their simple physical or chemical properties, the majority interact with specific target biomolecules. Understanding these mechanisms is crucial for developing effective treatments and ensuring drug safety. Only a few drugs act based on their physical or chemical properties. Examples include bulk laxatives like isbagula, which work due to their physical mass, and activated charcoal, which has adsorptive properties. Other examples are antacids that neutralize gastric hydrochloric acid and chelating agents like EDTA that bind heavy metals. Most drugs produce their effects by interacting with discrete target biomolecules, usually proteins. These target proteins can be grouped into 4 major categories: enzymes, ion channels, transporters, and receptors. Some drugs also act on structural proteins or nucleic acids, such as colchicine binding to tubulin or alkylating agents targeting DNA. Enzymes catalyze almost all biological reactions, making them common drug targets. Enzyme inhibition is a prevalent mechanism of drug action and can be competitive or non-competitive. Competitive inhibitors, like methotrexate, compete with the substrate for the enzyme's active site. Non-competitive inhibitors, such as organophosphates, bind to an adjacent site, altering the enzyme's function. Examples include cholinesterase inhibitors like physostigmine and monoamine oxidase inhibitors like moclobamide. Ion channels regulate intracellular ionic composition and participate in transmembrane signaling, making them frequent drug targets. Drugs can affect ion channels by binding directly to them or modulating their opening and closing. For instance, local anesthetics obstruct voltage-sensitive sodium channels, while nifedipine blocks L-type calcium channels. Other examples include quinidine blocking myocardial sodium channels and sulfonylurea hypoglycemics inhibiting pancreatic ATP-sensitive potassium channels. Transporters facilitate the movement of substrates across membranes, either along or against concentration gradients. Many drugs interact with transporter proteins to inhibit physiological transport. For example, desipramine and cocaine block neuronal reuptake of noradrenaline by interacting with the norepinephrine transporter. Fluoxetine inhibits serotonin reuptake by targeting the serotonin transporter. Other examples include furosemide inhibiting the sodium-potassium chloride cotransporter in the kidney, and probenecid blocking the organic anion transporter in renal tubules. Receptors are regulatory macromolecules that mediate the action of signal molecules, including drugs. They recognize the signal molecule and initiate a response but have no other function. Agonists activate receptors to produce effects similar to physiological signals, while inverse agonists produce opposite effects. Antagonists prevent the action of agonists without producing any effect themselves. Examples include beta-adrenergic agonists like adrenaline and antagonists like propranolol. Understanding receptor interactions is essential for developing drugs that can precisely modulate physiological processes.